episode, I wanted to talk about my health challenges. I have Crohn's disease, which is a condition of the intestines. For years, I thought it might have been psychological. A lot of people said that it could have been my diet. I spent years of being depressed and feeling hopeless because the medications that I was being given really wasn't helping much. But I met my doctor, who has been my hero. With the procedures and the medications that he's given me, I have my active life back, and it feels fantastic.
Basically what Crohn's disease is it's an inflammatory disease of the intestinal system. It can occur anywhere along the digestive tract. Usually it will occur either in the small bowel or the colon. It's basically your body's own immune system sort of attacking itself, and it's attacking specifically the intestines. Nobody really knows for sure what the cause of Crohn's disease is. But the thought that there is probably a genetic predisposition to it, and it's something that is triggering it to occur. A lot of pain. It can lead to fevers, it can lead to bleeding of the intestines, it can lead to abscess formation, and it can lead to things like strictures and fistulas, which is like abnormal communications between the bowel and the abdominal cavity. There's no cure for it. The objective is to get the Crohn's disease or the inflammation into remission and try to keep it in remission. The first thing that I thought of, first time meeting you, was that your disease was already very, very far along. I remember thinking that it would have been nice if I had seen you 10 or 15 years before to be a little more aggressive with treatment.
So on a 1 to 10, how bad do you think mine started out?
Well, I think in general, I think yours is
remission.
probably about an 8.
Wow.
Once every 6 weeks, I have to go and get a IV medication for my Crohn's, which really has kept me having a normal, active life.
Usually it takes like 2 hours for my treatment, but it's amazing because I feel 100 times better after I get this medication. Fitness magazines, and I just hang out, so it's done. I'm kind of tired, but at least I started my blanket. Blanket is in the beginning stage, so I'll be done soon.
When I think back to how sick I used to be before Remicade infusions and Dr. Blank, I spent days in the fetal position, nauseous, listless. That was my life. This here, running on the West Side Highway, that was my dream. This is my dream. I prayed daily that if God gave me my health back, I wouldn't take it for granted. And now that I have my strength again, I want to shout it from the rooftops. I want to get on the highest podium with the loudest megaphone and shout, "Stop being couch potatoes and work it